Healthcare has increasingly become a topic of contention in the past couple of months. I'm sure we all share the same curiosity as to how we are responding as a nation and what the industry has done to improve the quality of their services. And now here to share what lies ahead in the future of healthcare here in the Philippines, please welcome First Vice President and Sales Head of PLDT Enterprise, Mr. Mitch Locsin.
Good afternoon, everyone. I'm pleased to join you all today as we take a look at the emergence of eHealth industry in light of the changing healthcare landscape. Before we get started, I wanted to quickly give everyone a snapshot of the sector by looking at the number of healthcare workers and facilities we have in contrast to our country's population of 109 million citizens. Now, let's keep those figures in mind as we dive into today's discussion. Locally, our healthcare system is crippled by many difficulties. Even pre-pandemic, we already had an estimated shortage of 23,000 nurses. COVID aggravated the situation further, as 1,800 healthcare workers were infected by the virus and another 50 of them had succumbed to its symptoms. To make matters worse, hospitals across the country are now on full capacity, leaving the national government and various local government units scrambling to launch quarantine and testing facilities nationwide. But this doesn't even scratch the surface. The sector is faced with a shortage of rapid and PCR testing kits, hospital beds, medical equipment like ventilators. Now, I know that these figures might sound scary, but don't get me wrong. I'm not here to frighten anyone. I'm here to challenge this reality. Because of the current situation, many of us are forced to forego vital health routines like lab tests, annual checkups, or even dental consultations. But life has to go on. While we as a society have found ways to adapt to the situation, healthcare is simply an aspect of life that we cannot compromise. That is why, in response to the pandemic, the Department of Health, or DOH, mandated the practice of telemedicine before physical visits to a hospital or doctor's clinic for consultation. While at first, many of us saw this as a temporary fix, we realized that this is the way of the future. This inspired us to study the patient journey, allowing us to come up with solutions that enabled our vision of healthcare for all to become a reality in the safest and most efficient way possible. With this, we've identified three co-focus areas. The first and most basic is the access to e-health services. We wanted to ensure that this digital shift would enable more citizens to enjoy quality healthcare. This starts off with simple online appointment setting and consultation, all the way to remote monitoring services. Regardless of where the patient is, he is able to connect with a healthcare provider. It's that simple. Second is the management of e-health or healthcare records via streamlined patient data and digital documentation, ultimately enabling better patient outcomes. And last but not the least is the integration and collaboration of hospital management system for secure and efficient healthcare management. This includes a digital medical database, online payment options, a hospital management system, to name a few. The most immediate of these is the telemedicine services, which is why we at PLDT prioritize these in our eHealth roadmap. There are many telemedicine solutions out there in the market right now, but each features a single capability, leaving the patient and doctor to fill in the gaps in between. What we saw was an opportunity for a streamlined patient journey by having all capabilities in a single end-to-end ecosystem. We reviewed a handful of possible partners in the market, both local and international, and decided to collaborate with three of the most capable providers in the market with a vision to fortify these services for our customers and bundling such offers with our Smart GigaHealth plans and PLDT Home. With this, I am proud to share with all of you today our eHealth roadmap with patient journey that we at PLDT Enterprise have been working on, which we will be launching this month. First is the most important step of all. Is the first touch point for appointment setting, which can either begin in either a mobile app or a hotline for non-data users. This allows for e-consultation or teleconsultation with your doctor. After being diagnosed, doctors would then provide an e-prescription to e-pharmacies or online boutique drugstores like Mercury Drug, Watson's, Southstar Drug, where patients will be allowed to either pick up or have their medicines delivered. Another possible outcome is e-referral. Should a doctor recommend the further consultation with another doctor or for further testing through the e-laboratory capability. To make it even more efficient and relevant, we're ensured that these offers are fully integrated with HMOs and PhilHealth. We meant it when we said we wanted to streamline all the healthcare needs into one platform. I'm sure many of our viewers are familiar with those trendy automated remote diabetes maintenance devices and heart monitoring hardware solutions. So later this year, we are looking at integrating similar type of remote patient monitoring solutions and devices onto this app that we will be launching. Using AI technology, like I said, we want everything you need to be in one platform. Now, I know you guys might be thinking, who can avail of such systems? Once we go to the market, we will be covering B2C or business to consumer, or in this case, business patient models. We will also be covering business B2D or business to doctor models, and of course, B2B or business to business or hospitals, clinics, and corporations that are required to have healthcare facilities like the BPO industry. Last but not the least, we also intend to bring this even further to our LGUs or healthcare centers. So we reach the barangay level with our eHealth solution. The goal, after all, is to make the digital shift as inclusive as possible. We want to make eHealth services available to all Filipinos, wherever and whenever they need it, and with whatever digital media they use. Again, this is just the beginning. I look forward to the day when we can finally say that healthcare for all is a reality in the Philippines. Thank you very much and good afternoon to all. And now, to discuss what lies ahead in the local healthcare industry, let's all welcome Metro Pacific Investments Corporation Senior Advisor, Mr. Dan Horan.
This pandemic has affected so many people in dramatically different ways. And I guess one of the key challenges that we've seen is that it highlights the access to care and the difficulties that people have accessing care because of the physical nature of it. Our thoughts and prayers are with all of the affected families around COVID at the moment. Today, moving around the city and getting access to different locations, whether you're a provider of a care or the recipient, it's been incredibly difficult. So the impact on finding a doctor, booking them, paying for them, and having a consultation, it really now needs to be on a virtual basis, given these constraints. Through the booking systems that we've enabled, patients and even myself, you can go and book a test knowing that when you go to that location, number one, it's open. Number two, you've got a test, and ultimately then you'll get the results as they come out. Partnering with PLDT Enterprise has been extremely helpful. They bring together technology, innovation, and services. So these include ePLDT's cloud hosting services and IT solutions, through to the fast connectivity which is provided to hospitals, clinics, doctors, and of course the patients through things like fiber and 4 and 5G mobile networks. The PLDT team as a group has also got consultants who are well versed in the healthcare vertical to support the solutioning and strategies. So it's a great range of support services to grow and evolve your business. I think you could look at it in three ways in the coming years ahead for health: efficiencies, experience, and innovation. Digital services will drive efficiencies and change the way that people access services, improving the access and processes behind it between health providers, the customer, and insurance companies, resulting in streamlined access to care and cost savings. The second, on the experience side of things, digital technologies will fundamentally change the customer experience, allowing for the integration of ecosystem experiences and journeys rather than isolated functions. And finally, through innovations like AI, machine learning, remote diagnostic services, the impact on patients and the healthcare workers alike will be dramatic. Basically, on the self-diagnostic side of things, it can really assess the risk profile on a patient. So many solutions will look at symptoms, but as you may know, if you have chronic diseases and some other things as pre-existing issues as a person, these can dramatically influence the potential outcome if you do come in contact with COVID on your success rates. So the AI tools in the background effectively score you on a risk profile and then can funnel you into the appropriate care more effectively.
Thank you so much, Mr. Locsin and Mr. Horan. It is indeed inspiring to hear how different members of the public and private sectors have come together to improve the healthcare system through technology. Our next guest speaker has worked with Index Asia as a healthcare advisor, assisting healthcare companies across the region who are in the growth equity stage through M&A and fundraising. Previously, he worked as a healthcare specialist for private equity firm Partners Group and had a career in medicine as a physician and a pathologist in the United States and Singapore. Here to share with us his insights on the biggest challenges of the healthcare industry in the Asia-Pacific region, as well as the trends that have emerged during this current situation, please welcome BioConnexus Ventures Partners and Index Asia's healthcare advisor, Dr. Jamin Park. Hello, Dr. Jamin, and thank you for joining us on Tech Talk on Air.
Thank you. Good to be here.
Dr. Jamin, you have a very interesting presentation to be sharing with us. I'm going to give the floor to you.
Sure, of course. I hope I cover the topic well, because it's a quite broad topic. But obviously, I think we know that the biggest challenge to the healthcare in decades is obviously COVID-19. And it covers many aspects, including the patient access, the shortage of the physicians, etc. But I think one thing I like to focus is the medtech infrastructure. So if you look at the like ventilators, for instance, the equipment you need to help patients sustain during the COVID-19. If you look at all these countries, and if you take a look at the U.S., for example, they had about 160,000 ventilators in stockpile pre-COVID, among which about only 100,000 of the ventilators were functioning. While the actual demand required to meet this COVID was around 200,000. So basically, across the world, all these countries were not adequately prepared, whether you're in the developed market or developing market. In Southeast Asia, this weakness is even more pronounced. If you look at the figures from Indonesia, Thailand, and Philippines, etc., the Philippines had around 1,300 in stockpile, while Thailand had about 10,000, with Indonesia being about 8,000. And this is still grossly inadequate. And this was back in April. And you can know, now in August, you can see what happened after the past few months. So we were definitely not prepared for this pandemic on the medtech front. On the e-healthcare, it's a very a diverse field. The digital healthcare covers various aspects, including virtual care, including EMRs, electronic medical records, as well as screening pharma supplies and analytics. And two trends that were probably the most, I think, pronounced coming out of this pandemic was telehealth, as well as remote monitoring for medtech equipment. One example, the Singapore's MyDoc, the telehealth platform, recorded about 147% surge of daily users 3 months into the pandemic. I think what the trends that are going to be coming more pronounced in the next few years will be the telehealth and medtech remote monitoring capabilities going into tier 2, tier 3 regions, as well as LGU health centers. And in order to do that, there are various digital platforms in the region, but they need a strong local partner to drive this entry. And that's where I think Philippines strategics could work on, is partnering with digital players from overseas.
Dr. Jamin, thank you so much for those insights. I just wanted to jump on your point here. You did mention that we were unprepared here in the Asia-Pacific region compared to the other countries. But were we actually getting there before the pandemic? Were the trends already pointing towards the digitalization of healthcare? Or is this something that has now accelerated capabilities that we did not really have before? Are we going to be seeing much more disruption in this sector, or are we going to be seeing a continuation of some investment trends, some digitalization trends in the industry that were hopefully present before all of this pandemic came in?
Yes. So telehealth was, of course, has been around for last 9-10 years, and of course, the remote monitoring of the medtech equipment was, I guess, it was in the development, and of course, the electronic medical records with analytics. People have been adopting EMRs more and more to reduce the usage of papers. But now with this pandemic, it's going to be even more accelerated. Mm-hmm. I believe one of the conglomerates president, when they were asked about the use of telehealth, this was pre-COVID. They said that this was a bit too advanced, that they wanted to focus on the bread and butter, that this was not something that they wanted to look at the time. Mm. But after the pandemic, of course, now all the big groups here, healthcare providers, are trying to implement the telehealth to minimize the infection, spreading, but also I think meet the expectations from the patients. And this I think is it's a good sign. However, telehealth is going to be more than just the virtual care. You need also the equipment side, the medtech side, the remote monitoring. So that's where the telehealth can, I think, combine with the medtech and improve the care of the people in Philippines.
Dr. Park, how technologically advanced are consumers to take advantage here in the region? We have a much younger demographic compared to, for instance, Europe. Are we quicker? Have we been quicker to adapt to all of these changes and innovations in the system compared to other regions?
Unfortunately, the answer is actually no, because as you know, U.S. has been in the forefront with the Teladoc, the largest telehealth platform in the world. Of course, in Southeast Asia, Singapore has been spearheading this as well. Platforms such as MyDoc, Indonesia's HelloDoc already has millions of users. Here, I think the players were still trying to get a hold of the foothold. It's just that they were not able to find the support in the local community, especially with the conglomerates and healthcare providers, until this pandemic happened.
Okay, and our last question, Dr. Park, before we bring in Mitch Locsin here to talk about the PLDT side, just you've been in the M&A space of healthcare for a while now. What are the most exciting technologies you're seeing here, and have the opportunities changed because of the pandemic, and how are we going to move forward in this space?
Okay, well, telehealth definitely is a big topic, because this is kind of what brought everybody together, especially with COVID-19. But other things would be the remote monitoring of medtech side that all the big MNCs like Medtronic are pursuing. And another angle is, of course, the diagnostics. So COVID-19 also exposed deficiency in the testing side. And there's a lot of movement to shift things into molecular. So there are some deals happening in that as well.
Okay, so thank you for those insights. At this point, I would like to bring back with us on the screen Mr. Mitch Locsin of PLDT to help us, with this discussion, especially from a PLDT point of view. Sir Mitch, do you agree with Dr. Park that, we were unprepared for this? It was very difficult from a technological perspective. And what are the biggest challenges that you are facing?
Thank you, Danny. Yes, I do agree with Dr. Jamin Park. In what he mentioned, telemedicine has been there for how many years already, but the adoption here in the Philippines only took effect after the crisis, the COVID-19 crisis came about. So for the PLDT group, for example, it's taken a little bit of time, and it's mainly because we wanted to make sure that it covers the whole ecosystem. It's not just going to be an app-based appointment setting, online video consulting with your doctor, but it should include the e-prescription capabilities, the tie-up with drugstores so that we could actually also deliver the medicines, the laboratory requests, and eventually the tie-up with the HMOs, and also adopting AI and machine learning. So for example, the remote patient monitoring, which is very important for the near future or the new normal, for chronic care, like the AccuCheck, for example, which does diabetes monitoring and care. That's done remotely. That can be done at the back of your home. So these are the steps that we have taken with PLDT Smart and ePLDT that we will be launching in the next 30 days.
Sir Mitch, has this been part of the team's strategy in PLDT to venture into the healthcare sector? Is this something new that you guys, a new opportunity that came about because of the pandemic? And how big of a part of your plan will this now be in terms of the roadmap?
It's definitely going to be a major part of our approach. And it's mainly because, as you know, Metro Pacific Group of Hospitals is part of the MVP group. And we're not just looking at supporting the MVP group of hospitals. We want to go even further, not just supporting clinics, doctors. We want to go further to even to the barangay level so that everybody can actually start by doing telemedicine before going to any doctor's clinic or to any hospital. There is a DOH or Department of Health mandate actually that is asking the community that everyone has to pass through telemedicine before even going to the hospital or doctor's clinic. So with that, PLDT Group has actually pushed forward in this initiative. Again, it was mainly pushed by the COVID situation, but this is going to play a major part on the solutions that we will be bringing forward in the healthcare industry in the Philippines.
Dr. Jamin, maybe you can add to his point here that this is the future. You are a physician, does this completely replace the face-to-face consultation, the trust that we have? How can you replace, trusting a computer screen, a doctor in a computer screen, vis-a-vis somebody physically examining you? And is this just something temporary while we go through this pandemic and things will be going back to normal, or is this something that we need to be investing resources in?
I mean, of course, this is something we'll have to, continuously invest. And of course, you cannot replace the patient interaction in person because, doctors, besides taking history, they also have to do a physical exam, inspection, the whole picture. So you're basically taking out the whole picture. And that's the limitation with a lot of telehealth platforms right now, is that it's really essentially like a souped up Skype. And what they need is equipment, the tools to help with a diagnostic site that's linked with the telehealth platform. So that's probably one reason why, I'm sure the Metro Pacific Group also had a difficulty with the doctor, adoption. And this is not just one group, this is universal. That's probably the one aspect that they're going to have to continue to invest. Even after this pandemic is over, they have to make sure that this telehealth platform is connected with the e-prescription, with the EMR, but also the engagement side, the equipment that can replace, or do the best part to replace the patient-doctor interaction.
Sir Mitch, maybe a last comment on that. You have the technology, you are a tech company, and it's probably simpler for you guys to get people on board. As you mentioned, the Metro Pacific has the hospital groups. How do you get the patients on board? How do you get the physicians on board on your platform? And what are your targets here in terms of realistic timelines and number of people that you would like to service?
Yes, so again, as mentioned, we are in the test phase right now with the solutions. I can't mention the partners that we're doing it with, but we're currently live doing demo testing with one of the largest hospitals down south. We also have a partnership in Cebu Hospital. So that covers basically our testing phase with the various hospitals. But from a doctor's perspective, the solution that we are partnering with has already 450 doctors that are live in this telemedicine solution. Again, PLDT's trust is really just making it a complete ecosystem, as Dr. Jamin mentioned. So whether we're going to be bundling it with the SIM cards, the LTE SIM cards, the data plans that they need, the tablets that they need, and completing the whole ecosystem that includes e-prescription and delivery of medicines, for example, and getting the HMOs on board as well. Again, we're not just talking to the various hospitals, doctors, and to the consumers. We want to reach the far-flung barangays as well so that we get to cover the teleconsult side of things to the far-flung places of the country.
Absolutely. A great point there also, as Dr. Jamin Park said, it's very uneven when it comes to telemedicine. You have the capitals and the most developed countries. You mentioned Singapore, much ahead of the curve, and there is a very big need for other provincial areas that we're not reaching to be able to access these services. So thank you so much for those insights. That was, of course, Dr. Jamin Park and Mr. Mitch Locsin. It has been a very inspiring afternoon hearing about how some of today's sectors are accelerating their digital capability in order for all of us to move forward as a society.